Estamos de volta, bem-vindos uma vez mais.
We are back. Welcome. We will now be addressing the strategic telehealth plan. We have a question to be answered, which is, what about after COVID? I have three guests to come up on stage. Luís Pinheiro, who is the chairman of SPMS. I'd like to ask him on to his stage, as he is the host behind this initiative. Herdeiro, chairman of the board of the Central NHS Administration, who will be discussing the strategic plan, and Miguel Guimarães, who is the head of the Doctors Association, who will be with us remotely. The subject, the strategic telehealth plan. What about after COVID-19? And this is what I'll be discussing now, and I would like to ask you to take the floor and, first of all, give us a presentation on this subject and answer the question, what about after COVID? Luís, I'll begin with you. Thank you, Rosália. Good afternoon, everybody. I'd like to greet the head of the Association of Doctors, Mr. President of SSS, Vitor Herdeiro, and the Secretary of State for Health, who is in the room with us already. The strategic telehealth plan was one that was concluded and approved in 2019. It was designed before COVID-19. And I think we all agree that the area of health where COVID-19 intervened, it's obviously telehealth. And within telehealth, the possibility of having remote healthcare, where the contact between the patient and the healthcare professionals, or between the patient and the medical centers, isn't done in person. This was perhaps the one that has been most encouraged and has grown the most during this pandemic. So I'd say that after COVID, the plan will be certainly different to the one before COVID. Of course, it's important to say that the strategic plan that was approved in 2019, at the end of 2019, was one that looked ahead. It had features that led us to believe that it would stand the test of time, but perhaps it's already outdated. Well, we didn't know that this would advance as much as it did. We needed to drive this plan faster, of course, and now that we know much more than we knew at the start, we have an absolutely fundamental vector here that didn't exist at the start either, which is the acceptance the people have in general regarding the use of a series of tools and work practices that didn't exist before the pandemic. This cultural shift we are all experiencing is today the main ingredient for the operational plan for telehealth, the one that we're about to present, namely to present to the powers to the government. It has concrete and specific measures that will implement the plan with the measures that we've all taken from this pandemic. The pandemic had a huge impact on telehealth. Perhaps the greatest beneficiary of the change that happened in this year and 3 months was NHS 24 helpline. Right from the start, it was there for anyone who needed a door that was always open to be able to have a triage in the COVID-19 context. People were advised to call the helpline before going over. If people suspected that they had the disease, they would reach out. And because of the major campaigns of promoting this service, there were 1,485,000 phone calls during 2019. Last year, there were 4 million phone calls. I mean, this is a whole new scale. This year already, at the end of last month, it was already 2.2 million phone calls. It is an open door for people always. Another very important service was Trace COVID-19. Trace COVID-19 was a tool that was created during the pandemic to make life easier for doctors to track the patients who were suspected of having COVID-19 or who had already been diagnosed. And it's already got 5 million users, either because they called NHS 24 and they had a symptom that could be COVID-19 or because they had a test. More than 5 million people. That is more than half of the Portuguese population that has already used this tool. Will those helplines and those projects remain in place after COVID-19? Even if they don't, exactly in the same way as today, we will try to withdraw from them the main advantages and what they were truly innovative with, because Trace COVID-19 showed that it was fundamental to have tools that would enable healthcare professionals to work remotely, not just the patients, also the healthcare professionals. They don't need to be sitting down at the medical center. Trace COVID-19 also triggered the use of tools that make the most of the patient collaborating, self-reporting. For instance, the patient flags how they feel at any given time, which makes it easier for whoever is monitoring this patient. And this is great. And now, because of this shift in mindset and the lessons we are still learning during pandemic, because the pandemic isn't over yet, as the Director General for Health mentioned this yesterday. It's not over yet. And now with our hope is that the RRP will bring us investment that will lead to a decisive use of telehealth tools, because telehealth has a significant part here to play. The information system for professionals and information systems for people. So it is fundamental to have telehealth grow in this context. And before concluding, within telehealth, there is an area that is the preferred area, which is remote monitoring. We will have after this session, there will be an agreement signed between a series of Ministry of Health bodies, namely the local authority of Matosinhos, SPMS, and the regional North administration, because we are wrapping up a revolutionary remote monitoring tool. The head of the Doctors Association said at a conference that the diagnosis is done, the path has been set, just do it. And yesterday, in the Doctors Association Congress, I told the head of the association that we're here to do it, but we can't do it on our own. We need doctors, we need the associations, we need healthcare professionals to complete a plan as audacious as this one. Thank you very much. That is a good message. We have the head of the Doctors Association remotely with us, but now, Vitor Herdeiro, please, wherever you want to give your presentation, please do so. And then we'll speak to Miguel Guimarães, but now it's the chair of the board of the Health Administration. These were inspiring words by the chair of the SPMS. I'd like to greet the Secretary of State for Health and the chair of SPMS, and the head of the Doctor Association, Dr. Miguel Guimarães. Good afternoon, everybody. Good afternoon to everyone who is with us through our live streaming. Over the last decade, we have made our NHS more accessible to citizens and patients. The relationship between both has become dematerialized with the use of text messaging. People can now access remotely to their medical reports and tests. The issue is how to redesign the NHS to make it more accessible and with greater quality for the common citizen. It is not semantic. We've made quite a few efforts to maintain the system more accessible, but that is not enough. We need to change the way in which the system is designed. The premises are different every single day. An aging population and more chronic diseases will be the greatest challenges to the NHS in our time, and the effects can already be seen. There is, without doubt, a lot going on in the health sector throughout the world. The healthcare model is transforming itself because today we understand that the value of health, the value in health, is part of a greater chain that goes beyond providing care. To be healthy for longer is the challenge we have. And to overcome this, we need to integrate more information than the one we'd imagined. Connectivity, especially now at the time of 5G, is changing the world and people's behavior. The advances in digital technology, more enlightened consumers who are more connected and more discerning, inspire a debate on how to have a new vision of health that will incorporate technology as a fundamental resource and not just a mere instrument. With the development we know, many of them driven by the pandemic, it is difficult to envisage where we'll be at the end of this decade. Remote consultations as well as remote monitoring will certainly be a new normal. Throughout the world, we will have solutions that make the most of connectivity and the exchange of information, and we believe that they will enable more focus on promoting health and more efficient healthcare provision, and as such, autonomous life for longer. Big data, the Internet of Things, artificial intelligence, and so many of the tools that drive the development of a digital society will have a weight in developing the NHS. The challenge is the creation of a context that will allow us to shift from an analog culture to one that is truly digital and to benefit individual health and the health of our community and our country. Portugal has talent and the resources to turn this moment into a historical landmark for the NHS. The agenda will be, we want to focus this on the citizen, innovating in care, in services, having universal access, and adding a valuable contribution to science, which has become so valuable at trying times of the pandemic like the ones we're experiencing. There are essential goals in pursuing this path. To make available a medical record for each citizen so that information can be shared among all types of service providers, increasing access to care by having more medicine, more digital concepts, whether in the healthcare centers, diagnosis centers, or hospitals.
Allowed for relevant information to flow at the moment of the services are provided to monitor the patients and chronic diseases, enabling a timely response for primary health care, or also hospitalization cares at home. Results are shared between private and public operators, would counter a duplication of tests per year to promote and expand medical investigation research and have a platform to examine all the data, to make sure that all data is inserted in the SNS national service with financial indicators that are public and transparent. The creation of a digital ecosystem in the healthcare sector can launch us into a new era where all stakeholders, healthcare providers, universities, research centers, and particularly all citizens and professionals can benefit from that value of information that allows to expand knowledge and innovation. The value that this digital ecosystem can bring to the Portuguese economy will be growingly evident, as has been seen in other economies, helping foment the offer of quality offer of Portuguese businesses. The role of shared services as PMS is crucial as an instrument and suitable vehicle to implement this digital ecosystem and bringing together the means and the talent, but also speed that will help us get as close as possible to as soon as possible to these goals. We can rely on our commitment to support all initiatives to help reach this design of a more digital that provide a more effective response. This is the challenge that needs is a careful discussion, include goals and working with SPMS and healthcare units and maximizing the availability of investment that the country is going to benefit from with the monies of the European Union. We have access to patients, different associations to building this future. Let's get to it. You can rely on us. Thank you very much. Thank you very much for your words. Thank you, Dr. Herdeiro, for also the framework that you laid down here. Now I'll pass the floor to Miguel Guimarães, who is the chairman of the Medical College of Physicians.
You are remotely linked to us. Thank you very much for your presence here today. We are here to discuss the subject, the telehealth strategic plan. What about after COVID-19? And I would like to ask you for a small introduction to the subject and the response and how you can reply to this question. I don't think that he heard us. I am seeing him on my screen. He is linked to us. Let's check if he can hear us in this session. What about after COVID-19? The head of the Doctors Association, Dr. Miguel Guimarães. We will try again. I believe he still can't hear me. And while we try to connect, let's talk with Luís Pinheiro and Vitor Guerreiro. Mr. Vitor Herdeiro, I was listening to you, and I'd like to ask you if, given all these challenges we have ahead of us, do we need to review the model for hiring, for paying based on results, or creating incentives for good practice? Well, we do need to perfect the model. Obviously, we need to improve everything at all times. Obviously, the model for hiring professionals can also be improved, and we are committed to this goal. The question you ask has more to do with the way it works and for results-driven payment. Portugal was perhaps one of the first countries in Europe to have the homogeneous payment. We were innovated, and whether it's us or whoever came before us, we have an important role in this. The financing per value is something that we are thinking about in the future, but I won't say that it is something that we are planning on doing tomorrow. This is a path we're on. Last week, I saw a pilot project in Porto, value-based healthcare for a specific pathology in cancer. So we need more pilot project. We need more know-how. And there will be a transformation that I hope won't be a far future, where more than having volume, we will have value-based healthcare. The future of healthcare is through the digital field, that is, and also financial sustainability. Do you agree with this need of reviewing the way in which professionals are hired, their incentives, and the way people can be paid, results-based, so that future can advance, so that we can advance? I think all the instruments are valid when we want to go down a certain path. At this moment, and probably since always, the SCSS and SPMS, who came from the same parent institution, are now side by side to fulfill these goals. And hiring and funding, and the funding model and the priorities are the driver for the path we'll be on. We've already spoken about this at large. The vision that we both have is common, and it entails understanding evidence. And I think that this pandemic left no doubts. Digital is the main driver for efficiency and efficacy, for the fastest way of serving people. And from this perspective, we all know that ACSS needs us and we need them so that we can achieve this goal. It is impossible to get there fast because there are opportunity costs that we don't need. We can't miss out. We need decisions on investment, hiring with healthcare units that don't include promoting certain behaviors, certain vehicles, certain paths. So I respect telehealth. If telehealth isn't promoted in its various scales, then surely in many cases it won't be possible to use it fully. So I think that in that aspect, to know that we share in a precise way the paths that we must be on is very good for me, and I know I can count on them, on ACSS, and they can count on us. That is well underlined. Let's try to talk to the head of the Doctors Association again, the chair of the Doctors Association, but I don't think so. So we'll continue to talk until I am told that the link is up and running. So digital is shown to be the best system in the world, but it also fails, and that is why being in person is now better. Still talking about this, you mentioned several challenges in terms of digital implementation. The idea of investment was the elephant in the room, and we needed to talk about it. But now we also have implementation, and to help this digital network to reach all the Portuguese. Not leaving anyone behind is a slogan we hear the government say a lot. How is this done? How can this be done with this strategy? Not leaving anyone behind. We need to think about our joint approaches. We can't just look at digital tools without thinking about the way in which they will reach everyone. Because of past lives, there is a certainty that I have acquired over time. If we ask people less, because we already know what they need, at that time, we will be dealing with a digitally excluded elderly who lives far away from the city center somewhere, who doesn't have the public service, and the young computer engineer who lives in the center of Lisbon. We need to invest in services without people's contribution. That is a role that we need to be on. The services where the state delivers a service without needing the citizen to systematically ask the state for the state to give it what the state already knows they need. This sounds evident, but it is a path that we need to be seeing. Technology does not create imbalance. It levels out. With technology, we can serve more people in a more equal way and not the other way around. We see this every day. We see it happen every day. The more we need people's knowledge and the capacity to deal with anything, to be able to interact with the system, then surely the better we will be serving everyone. And technology helps to correct inequality. It is with technology that at the NHS 24 we can talk to deaf people. It's through technology. If we didn't have video conference with our phone, we wouldn't be able to talk to the hearing impaired. An example of inclusion and cohesion, yes, Vitor. I would just like to highlight this synchronization between ACSS and SPMS and the relationship, which will be very fruitful in the coming years. I would like to take back an idea that I spoke about at the start. Digital cannot be seen as instrumental. It is fundamental. This aspect of digital, it has been very instrumental in many things, but health means that now it needs to be fundamental. So anything like remote monitoring or remote rehabilitation are issues where digital is part of the provision of healthcare. And I think that the developments we've seen, it will be difficult to anticipate where we'll be at the end of the decade, but there are a series of issues that has to do with collecting and harnessing data. What people talk about now as being a data lake, and what that has to do with medicine that is patient-specific. So what we have coming with the role of digital, it is fundamental to see this, more so than we can even imagine. We will see it this decade. Hopefully next decade. It has already been said that the pandemic was a launch ramp in terms of the attitudes that we all have towards the digital world. What do we need to do so that we do not let the momentum go? Well, we need to give it time. We need to use the inertia, the movement, and not wait for the RRP. Well, the RPP will come, but on the one hand, we can't just sit around waiting. We need to continue. We are on the path. I spoke about this agreement that is an example. Without RPP or not, remote monitoring needs to come to the NHS and to provide care, to generate data, and the data lake needs to come to us too, with or without the RPP, the RRP. And obviously, if we have more fuel, then it will be faster. It'll be more ambitious if we have the money, where we can take the project, but we cannot stop. We are at cruise speed. Those who are outside the area of technology, we cannot, if anyone is outside this area, we cannot even begin to tell them our speed. So we need to use this balance to create the true digital transformation in the healthcare sector. And as Luís said, it is important to count on the doctors. We have the head of the Doctors Association after COVID-19, Dr. Miguel Guimarães. We would like to hear you on the subject. Can you hear me? Yes, I can hear you. Good afternoon. I haven't heard anything so far, so I'll speak as though I hadn't heard anything you said. First of all, I'd like to greet the chair sitting down here. And I'd like to greet you and everyone who is listening to us. And I would like to tell you that this is the right time to turn digital, to have the digital transformation that the health system as a whole needs. One of the lessons we will draw from this pandemic is that it is possible to better optimize the mechanisms to practice health or to have remote medicine. Regarding the contacts with doctors to doctors, I'll give you a concrete example. We have a tool here, an amazing tool to improve communication between primary healthcare and hospital care to do what Canada did. So you had the primary healthcare doctor gives all the cases that he wants, and the hospital doctor from the various specialties will say if the doctor needs to go to the hospital or not. We have a great advantage, which is that only the patients who need intervention of certain specialties will go to the hospital. Others can be handled or dealt with at the primary healthcare unit with a doctor of whatever type, a cardiologist, for instance. And this can help to bring savings in terms of travel, resources, the relationship between primary healthcare and hospital care, which is something a lot of people spoke about. We have remote consultations with images, with equipment, and I think the chair of SPMS said that if the recovery and resilience plan has advantageous funds for the digital transformation, then it will be faster. But I would say that at this time, it is mandatory. We need to re-equip the various health units, the software, the hardware, and communication lines that we have today through the internet. They need to be fast so that we can, with the quality, the security, and the protection that is required, to be able to communicate with our patients and replace some of the in-person consultations with remote consultations and introduce into the system monitoring through apps and phone calls with imaging, yes, of several types of chronic diseases to avoid a patient with a chronic disease to have to go to a consultation at a hospital, say 4 or 5 times a year. If we can have the system centered on patients, and with this help of telehealth, we can help control a lot of chronic diseases and avoiding people having to go to hospitals as much. But there is something important here that I must highlight. First of all, equipping the healthcare units and facilities. What happened during the pandemic is something that we cannot repeat. We cannot be dependent on phone calls only. We cannot be dependent on people's personal phones. We need devices and equipment. We need to be able to do this. The second aspect is training. I think it is important to start improving training within the learning, the lessons that some of these tools can require from healthcare professionals and doctors. This is something we need to take account of. And I think that this is the right moment. It is an important moment. We can improve the response capability of the NHS without hindering the relationship between doctor and patient, which needs to be, as Pope Francis said, the last point of humanism and solidarity between people. I would like to ask you if you believe that this investment in digital will allow us to recover some of the delays in consultations, namely with non-COVID patients, which was worsened by the pandemic, and which could use instruments such as these. I think that this delay in consultations isn't recovered with telehealth, and I'll explain why. What is the greatest drama that we have at this moment with the patients that were left behind? It is not the patients we know. It is not the ones with a name. The ones that I know have a certain pathology and that needs a certain type of treatment. The greatest problem are the patients that are not in the system. If we think about it, in 2020, when compared to 2019, we registered 151,000 less patients for surgery, 151,000 less patients for surgery. 23% of the type of patients who normally have surgery were not registered. They didn't get into the system. And as we know, in terms of primary health care, there are millions of consultations that weren't done because general practitioners were channeled to fighting COVID, namely for trace COVID, nursing homes, and other regional units. This means that the hospitals in general received 30 to 50% less consultations. If we can add to this the normal screening for cancer, there were 450,000 people less who in 2020 weren't screened for cervical, rectal, or breast cancer. When we compare these 2 years, at this moment we have thousands of patients who didn't go into the system. They don't have a face, they don't have a name, they don't have a diagnosis, and they don't have a therapy. And this is the greatest challenge we have now, and this challenge cannot be solved through telehealth. The patients that we know about, the ones who have identified in terms of chronic monitoring of diseases, in terms of first consultations that were being held and need another approach, patients who need to be monitored at hospitals, for those, yes, telehealth can give a good input. Thank you very much. Vitor, how do we help solve this, and how can digital, according to the chair of the Doctor Association, help with these patients who are now waiting? And after COVID, we need to take care of everyone.
Well, we counted on the extremely relevant role of the healthcare providers in healthcare centers and hospitals, and we're counting on them, and we see that population recovering every day from the delays that occurred because of the pandemic. And the ministry is also making an effort as regards tracing and recover some of those tests that were harmed because of the pandemic. And so e-health can help in one way or another, and it will help in many ways. And I understand that, Mr. Chairman, there is a need here. Many of these practices also have to do with the first appointments, and what happens. It's much more relevant than what happens in follow-up appointments or consults. What I see is that every month, January, February, March and May will be even better. There has been a gradual improvement. And so it's on the ground with the healthcare practitioners in the hospitals and healthcare centers that will be able to recover that lagging behind. Well, Luís launched a challenge here that we need to rely on the doctors, and when we lost the connectivity, and I wanted to retrieve that line of thought. And since we have Mr. Chairman here, what did Luís want to say exactly to Dr. Miguel Guimarães that was lost in transmission. Well, you told a while ago that the plan was drawn, the way it was open, just do it. So what I wanted to say is that we will surely do what we have to, but we can't achieve it on our own. We need the professionals, the healthcare practitioners. This is a path that is tread by everyone. And this is a path that is where we have to serve the present and retrieve the past, because the pandemic stalled many things. It stalled the world and the country. So we have to break that inertia, that global stalling, because many of the consults were stopped because many people were afraid of going to the doctor. So it's crucial to look after the present, but also to look after the past, always looking into the future. It's ever to be better prepared to challenges such as the one that arose during the pandemic. And e-healthcare can provide efficiency, facilitate the life of the citizens, and cut back on the time and match healthcare practitioners with the patients. That will be an improvement. A system that functions better will serve better, and it serves the present and will help retrieve what happened during a pandemic to the world. Mr. Chairman, one last word and a comment on what has just been said. Well, I think the chairman of the SPMS really hit the nail on the head. We are available to work with the state, with the health minister, SPMS, ACS. Our main goal is to retrieve the patients who were left behind, and we have to treat all the patients that show up every day. Like everyone said, these issues never stop, and we're lagging behind not just in health, and they're happening in very areas such as economy, finance. There are many problems that we'll have to deal with. So we have to deal with them in the most intelligent manner as possible. I think the digital transformation is an opportunity that we have, a major one, to speed up this recovery process. So we need help. We need for the government to support SPMS, and SPMS should be more have more financial means to effect the modifications that are necessary in the system. Dr. Luís knows perfectly what he has to do. He has experience, he has a good team, but he also, to do some things, he needs money. And this is the moment to invest, to change many of the things that we did. I think that even SPMS set up referral centers, emergencies, the hospital of the future. It's no longer one of the future. If we have a hospital that's functioning like 50 or 60 years ago, we have to update ourselves. We have to reform the hospitals, and it's we've been waiting for it for a long time. People will start looking at things differently. They went through a pandemic. It was hard. It's not over yet. Of course, we know that. We now have the pandemic under control in terms of its seriousness and the number of casualties. What does this mean in practical terms? That we can look into the future in a different way. We've been able to do that for quite a while now. This is the moment of being together, of doing things together, and make it happen. That's what Dr. Luís said. It's what Nike has as its motto, is just do it. It's one of the most beautiful things there are. What we have to do is make it happen. Because if we draw many plans in 6 months ahead, we still haven't decided what to do, it's obvious that we're wasting time. And time at a moment like this, when we need to look at the present, recover from the past, and look into the future, we need all the time. as possible to do it. Well, we need time and investment, says Mr. Chairman. Is that so, Victor? Without RRP, it's time to invest because the pandemic showed that with the pandemic, the National Health Service is essential. Yes, it's time. I recall that the Health Ministry has been investing strongly on the National Health Service, SNS, and there are investments, important ones, that have to be done over 2021. And RRP will produce great leverage in the digital field. It is also, the digital field is also included as a strategic area in RRP. And so, Dr. Luís Góes, I would say that we don't never have all the means that we would like to, but I think we'll have enough means to help effect this change that we all expect, that we'll all be working for. And so it is surely an opportunity, a golden opportunity that we cannot miss. Well, do you expect they will be enough, and at least 2 or 3 priorities would have to be on the outlook of decisions? Well, yes, I would say that besides this digital topic, we also have the topic of our conversation, the issue of having the patient at the center, integrating the healthcare. It's also at the end of the day, it's very relevant because it helps uphold the sustainability of the National Health Service, SNS. If there's a lack of integration and joint work with integration, we go further in terms of healthcare. Integration costs money. It doesn't help the sustainability of the system. So we have, these words are worn out at the knees, but we have to put the patient at the center. And everything will contribute to the sustainability of the system. Thank you, Luís. Strategic plan priorities, the same question. If we only had the resources to pick 2 or 3, what would you think they should be? Definitely telehealthcare, and if the exchanges of a patient with a professional doesn't add any value, well, that should be discarded. We have to rationalize the time of both. Sometimes the patient, oftentimes, is also a professional, and so we have to optimize the time that he's in contact or in exchange with a healthcare unit. So Mr. Chairman also touched that we have to reform and improve the systems that serve the healthcare practitioners directly, because it's relevant from the standpoint of their performance, but also because it's from the standpoint of the self-esteem of the professionals and healthcare professionals, and that's an impact on the outcome. It's very important also to have a policy for data. We have to look forward. We have to look at what we're doing now, but endow the system with the capability of doing something tomorrow. We all are aware that regardless of the world that we're living in, that SNS has to come out of this crisis much stronger than when it began. So everything we do we'll have to think of today, but most of all we have to think about tomorrow. I'll go back to Mr. Chairman. And ask you an answer to the same question. Resources will always be scarce in health, and also happens in newspapers. 3 priorities for the SNS, as you see. Well, we are here talking about digital transformation, so that I think that digital transformation is one of the priorities, and we have to understand it within a comprehensive range of topics that bring direct benefits to the National Health Service and to the patients and healthcare practitioners. This digital transformation must extract from the usual procedures those circa 30% bureaucratic tasks that have to be performed by doctors and healthcare practitioners have to perform. If you can remove the bureaucracy in this health sector, we are gaining time for patients, gaining time that has been wasted, and we can improve our ability to respond. Another important aspect that I will exclude financing. It's absolutely crucial. I understand that we can spend more or less money with the National Health Service, but what we spend today in terms of renewal, of transformation, we will harvest the fruit of it further down the road. We still haven't done it, and why? We have two more problems, or three. We have two priorities. We have problems between the relationship between hospitals and primary health care, continued care, palliatives, and emergencies. We all have to put our stakes in prevention and literacy, which are the main pillars of the National Health Service that we want it to be efficient and sustainable. And we have to put our stakes in this field to improve healthcare and access to healthcare by the patients. Last but not least, I would say that it's crucial this time to reform the hospitals. When we have this, when we mentioned the patient at the center, well, we already have that. The Cancer Institute in Porto does that. The concept of services in healthcare, etc., is totally different from that practice in other hospitals, namely public hospitals. We are within the concept of the public hospitals, and this reform is important because it will be more directed towards the patients, put the patient at what we say at the center of the system. We'll always talk about it, but we never do it. But it would also increase the efficiency of the procedures. It will decrease the likelihood of failure, and will improve the quality of the healthcare that we provide to our patients. So I would enhance the three characteristics. Thank you for the three messages and priorities also picked here by the other participants. I would invite you to remain with us in the upcoming months, and as well as the other guests, and Victor too, because we will be signing a protocol of cooperation for implementation of the telemonitoring solution of outpatients in the northern region. And to sign this protocol, besides the ones here on stage and Luís Pinheiro, I will call to join us António Taveira Gomes. He's the chairman of the board of ULS Matosinhos. Please join us here on the stage, and I take the opportunity to ask to bring here for the table to be brought here and the protocol. Carlos Nunes will not join us right now, but we'll sign later the protocol. Please join us here on the stage.